There you go.
Well, today I would like to talk to you all about cervical cancer and the causes of cervical cancer. My cousin complained of having prolonged vaginal periods, but when she went to her doctor, she was diagnosed with the human papillomavirus, and it was actually an early stage of cervical cancer. She was 17 when this happened, and fortunately for her, it was caught early enough to where it could be completely taken out, and she is now cancer-free. Someone very, very close to me, my cousin, she's my first cousin, she has cervical cancer, so which is why I am very, very, very passionate about people being educated, especially about the virus that causes most of the cervical cancers we see, which is the human papillomavirus. The initials are HPV, and initially when my cousin found out about it, they just sent her a letter in the mail, and she saw the H and the V, and she thought that at first that it was HIV. And so I just want to talk to you about how cervical cancer is more common than we all think it might be. And this human papillomavirus is actually a sexually transmitted disease. So I'm going to give you some information today on three things. About cervical cancer is 100% curable when it's treated early, and the human papillomavirus is a major cause of this cancer, and yearly pelvic exams can detect the cancer in its early stages. So according to the American Cancer Society, a procedure called a colposcopy can be done in an outpatient setting. What happens is, I have a picture for you so you can kind of see what I'm talking about, because I know especially the guys may not know what a cervix looks like, but on the cervix, you'll see in the vaginal canal, at the end of the vaginal canal, there is the cervix, and you'll see some changes there. And what ends up happening, because it is sexually transmitted disease, and even with the condom, that's the dangerous thing about it, that the condom, because it is a virus and we do not have cures for viruses, this particular virus is so powerful that even with the condom, it's still transmitted. There's no way to prevent getting it. And males are carriers and they don't have symptoms. They are completely asymptomatic, but it's the woman, and which is why I always tell women whenever I come in contact with them and we talk, please make sure you get your yearly test, because it'll detect some precancerous changes on your cervix first. So I'm going to pass this around so you can see the early stage where there's just a little bit, as opposed to when it's in the late stage, so that you can look at that and kind of see what the cancer changes look like. This colposcopy is just a little procedure where it's like a little clip, and they just go and they kind of clamp the cancerous. It's outpatient and it's done. You can, kind of take it easy afterwards. They put betadine on the cervix, and you'll have some spotting sometimes afterwards. But they just get the cancerous cells off, and instead of going every year, you go every 6 months to make sure you have a normal path. The human papillomavirus is this major cause of this cervical cancer. And it is the most commonly sexually transmitted infection. And there are over 40 different types of HPV, and that can infect the genital areas of males and females. And they can also affect the mouth and throat. And these people who have it, they don't even know that they have it. And that is according to cancer.org. When a woman is infected with certain types of HPV, the virus doesn't go away on its own, and then abnormal cells begin to develop. And that's when the abnormal cells, all they do is something called differentiation. And this differentiation is they just continue to multiply, because viruses have a program for survival. So they just continue to multiply and replicate. So before you know it, a person can go from stage 1 to maybe a stage 4 cancer, which is why it's very important that you get your yearly test. The yearly pelvic exams will diagnose it. And these are some ways I want to leave with you to prevent cervical cancer related to HPV. First of all, being in a monogamous relationship and just being very educated about your sexual health and your partner. And then seeking early intervention for women, making sure you get your yearly PAP, and still do continue to use condoms. I'm not saying go commando and just whatever, live it up, because there's no way you can do to prevent it. But and also there's a vaccination. Gardasil.org talks about this vaccination that will prevent women from getting this particular disease, and they also are trying to make it readily available for men since they carry it and don't know. So I do just urge you today to use sound mental judgment, stay current on cervical exams, vaccinate yourselves. And today we have learned how cancer is 100% curable when detected early, and how HPV is a major cause of that cancer, and how yearly pelvic exams can detect cancer in its early stages. So to prevent the spread of HPV and to prevent many cervical cancer-related deaths, I challenge you to remember the dangers of human papillomavirus going undetected. And I challenge you, women, get your yearly paps. Brothers, if you have wives, girlfriends, sisters, encourage them to get their pap smear. And I thank you for your time.